Ladies and gentlemen, welcome to another episode of Legally Speaking. I'm your host, Oves Anver. Healthcare. The healthcare sector, over the past 6 years, our budget has doubled in rupee terms. But if we look at it by factoring in inflation, it's actually gone down by 10%. If we complicate things further and we factor in population growth within the 6-year period, per capita budget spending has gone down 20% per individual. This is neglect, and there's really no other way to look at it. To discuss this, I am joined by someone who has both a bird's eye view of this issue. He's been at the top of policymaking, but he's also been in the trenches and is looking at how we can reform this system. And this is none other than Dr. Zafar Mirza, who is former special advisor to the Prime Minister with ministerial status, adjunct professor of health systems, and president of the Pakistan Association of Lifestyle Medicine. Welcome to the show, sir.
Thank you. Thank you for having me.
Thank you, sir. So you had quoted in a recent article that the public health crisis in Pakistan today is a collective failure of successive governments, and its reform is a collective responsibility of the state and society. Now, this, you're talking about, a whole of society approach really to dealing with this. And looking at, the state's response, recent budget, I think less than 1% of GDP was allocated to healthcare. Do you feel that, the state is doing its part within this this solution that you've proposed, sir?
Well, thank you once again. Actually, when I say it's a successive failure of governments in Pakistan, I really mean it. Because whatever the government was, whether it was a military regime, whether it was a civil government, right from the beginning, barring, excluding initial years of Pakistan,
absolutely,
no government has prioritized healthcare in the country. And that's why instead of just pinpointing this government or that government, I think we need to take a holistic approach. Mm-hmm. That where we are coming from, where we have faulted, and then obviously we have to take a collective responsibility. When I say collective responsibility, it means that as a whole of society, we have to take stock of this, that how we can
reprioritize,
provide some solutions to it, which are sustainable, etc. And why it is important? Because there are consequences of this. And in case of healthcare, the consequences are human health and human life.
Yes.
And our public health situation currently in Pakistan is loud enough, is visible enough, and serious enough to do something about it, and do something very immediately. Mm-hmm. There is no other word, but to use the word crisis. We have a full-blown public health crisis in Pakistan. All the major groups of diseases are rampant and growing.
Wow. You
use the word growth with reference to budget. Only thing which is growing in Pakistan is the population.
That's true.
Everything else is not only the victim of this growth, but also undermines the efforts which we do. And we have miserably failed in controlling our population as well.
Absolutely. And that just becomes a compounding factor in so many of these events, especially in healthcare.
Yeah.
Right? So where do we start when it comes to reform? Like, there are, sometimes you look at the problem and it's so big that you're afraid of where do you even start? But in Pakistan, so what would be, say, a low-hanging fruit, or what would be first steps that we can take as society?
So an easy answer to this, and many people would start with this, that we need to spend more money. Mm-hmm. I don't start with that. I take even step back from resources. It's the mindset.
All right, sir.
It's the approach. And it's the question of equity and governance. Mm-hmm. These are the big ticket items that if we do not address them, resources will come down the road, of course, that's very important. But then governance failure is such that even when we have so little resources that we are spending on health as government, I think the indicator of this governance failure that I'm talking about is that even the little that we are spending, how we are spending it. I mean, how can you justify that 122 billion rupees, just to give you one example, 122 billion rupees from 2015 to 2023 have for HIV, AIDS, TB and malaria, which had come from outside Pakistan through Global Fund, have remained unspent.
My God.
When you have such a heart-wrenching crisis going on, when you have children getting infected with HIV, when you have hapless people, and the epidemic really jumping from high-risk groups to the general population, our children are getting infected. Money is coming from outside. The latest auditor's report of Pakistan tells you that in this background, 122 billion remains unspent from 15 to 23. How you can explain this? So is it a question of not having money or not having additional money? Definitely that is a problem, but is it our real problem?
Is it the first problem?
Is it our first problem?
Yes.
No.
Absolutely.
It's the mindset, it's about. Now, if you speak with some health economists, and especially from the government, or our Ministry of Finance and people who make budgets and who are responsible for budget making, they will tell you, if you tell them that why it is not a priority. I mean, we have such out of proportion problems of public health in Pakistan.
Absolutely.
Which are screaming at us now. So why we do not allocate enough? Why we do not spend enough money on them? So the standard answer that you will get from them, oh, but yes, we understand this, but there is a fiscal space problem. We don't have enough fiscal space in our budget because of so many, budget debt servicing and defense and this and that. And I always say that it is not a question of fiscal space. It's a question of fiscal prioritization.
Absolutely.
When you do not prioritize anything, you will never find space for that.
Absolutely.
So the mindset, the approach, that is for me is the most killing problem, and in this case literally killing problem.
Absolutely. There are lives at stake.
So that's why I emphasize so much that we have to change our approach. We need a fundamental paradigm shift, that people's health is important, and it is a basic right of the people to have decent essential health care available to them. Diseases which are preventable must be prevented. Diseases which must be managed. And there should be, across the sector, there should be a very hard accountability.
Absolutely. So you had mentioned the word equity, and I want to get to that a little bit because I think it speaks to so much that I discuss on this show, but we discuss generally, elite capture in Pakistan or the equity question. But before that, I wanted to come. So the 18th Amendment devolved a lot to the provinces, and healthcare being a provincial subject under the current constitutional dispensation. Do you feel this is a hurdle to dealing with this, or do you feel that is not part of the problem, that we can still achieve the aims even if it's somewhat devolved in that sense?
I think it is an overstated problem.
I see. Okay.
The devolution is an overstated problem in health. Indeed, it has created some problems because the haste with which we did devolution in 2010-11, we did not thought through the problems because the political expediency pressure was such, because we should not forget this, that this devolution was provided in 1973 Constitution.
That's true.
It had to be done then.
That's true.
So we were very delayed. Now a window of opportunity came, and People's Party government was there, and they sort of championed it. So I'm not against devolution. Devolution is very important for Pakistan. However, in social sectors, and when we removed the concurrent list, so obviously huge chunk of healthcare went to provinces. That is still not an issue had we also managed it properly.
I see. I see.
This is not to say that the division of labor between federal and provincial governments is good. It's not good. Either we remain on this end of the pendulum, or when the pendulum swings, we go to the another extreme. So the point is that there are definitive national functions in healthcare.
Absolutely.
And there are, when it comes to service provision, which also require a big chunk of budget, it has to be provincial.
It has to be district, provincial, and all those.
There are two ways about it.
Absolutely.
But one generic problem with devolution is also that power devolved, executive authority devolved, budget devolved from federal to provincial level, but it not went from provincial to district level.
I see. There's a bottleneck there.
Yes. And the reason for that was that we didn't believe, and we still do not believe, in active local governments.
Yes, absolutely.
We have not really empowered them. We have not given them executive authority. We have not given them resources. Service provision. You have traveled so much to high-income countries. We all have. Service provision is always at the local level.
Absolutely, on the ground, where
where
the people
it matters, where the mouth is.
Absolutely.
So, health, education, roads, policing, these are local government functions. So that's why I call it also governance failure.
I see. Absolutely.
So since we have not gone beyond provinces, so that's why provincial governments and the provincial capitals are drowning in money. And the districts, as far you are from the provincial capital, it's directly proportional, or inversely proportional, I should say, in terms of their budgets and cash and the availability of liquidity. So it's fundamentally, it's not a problem of devolution. The way we have managed it is a problem.
I see.
So that's number one. Number two, I think it is also very important that provincial autonomy should not mean that there is no national responsibility.
I see.
In healthcare. So just to give you two very quick examples, Pakistan has to be represented in World Health Assembly.
I see.
Every year.
Okay.
In May, there is a standard World Health Organization convenes a global parliament of all health ministers from all member states.
I see.
If you don't have a national health minister, who will represent Pakistan?
That's true.
4 provincial ministers will go there, or who will go there? This is just a very small, minor example. Another very important, if there is a national emergency, we had a COVID, we have global pandemic.
Absolutely.
You need to have a national response to it.
That is true.
Which cuts through all,
the red tape and the different hurdles that come up.
And all that. So you need to have a national. You have a national function there. Especially
for health security and for ensuring that.
Absolutely. So a number of other areas where you need a national role. So this idea.
I would also say for harmonizing, because you had mentioned equity, but we're also talking about equality amongst provinces, right? We have a dispensation in which there is one, very large province, and then we have smaller satellite provinces, and then provinces like Balochistan, perhaps to a lesser extent KP, but these are neglected areas at times, and so that harmonization as well.
So as per se, I don't see, unlike many other people, even many people in the health sector, they also now sort of lament that because of devolution this happened. I don't think so. Even if there was no devolution, our state would be as bad as we are now.
I see.
So things have to be managed in a more comprehensive way with a holistic approach.
Absolutely. So coming to the equity question, I think this is bringing it back, and so you've written on this extensively, and I think you really hit the nail on the head when you say that it's not a priority for those who are the policymakers, who are the decision makers today. And if we're looking at Parliament, which is filled with individuals who are from an elite background, and the worries of, say, rural Pakistan do not necessarily concern them on their day-to-day. It's not their child who is suffering from HIV because of a reused syringe or something like that. Now, in such a situation, how do we get the message across that this is a priority for the people? And it's been neglected for the past 70, 80 years. But now, it's become too late now.
Yeah. Very, very critical point. Very, very important issue. But you see, again, what to talk about health sector? Equity is a political issue, a governance issue in Pakistan. Had it not been, our allocations would be very different.
I see, sir.
We would not have this much poverty in Pakistan, which is increasing by the day. Currently, about 40% of our population is below poverty line.
Below the poverty line.
Right?
Absolutely.
The women condition, the children health, out of school children,
26, 28%,
and you name it. So it cut across. The question of equity is a societal issue, and governance issue, and a political issue. When it comes to health sector just reflects the overall trends and the overall situation. It's not limited to health sector, it's overall inequality.
The health sector is one symptom of this overall malaise.
When it comes to health sector, the inequity manifests itself in terms of prevalence and incidence of diseases in poor people, in rural populations, in far-flung districts. And it is very systematic and it is very structured. Why I say this? Because I give you two figures. If you don't know, you will jump out of your seat. We have no district data about government health expenditure on health.
I see, sir.
Right? So, according to government figures, in Lahore, we spend around about $70 per capita.
I see. Wow.
In Muzaffargarh, in Dera Ghazi Khan, in other southern districts.
Southern Punjab,
and I'm talking about Punjab.
The richest province.
I'm not talking about Lesbela, and I'm not talking about Kohistan, and I'm not talking about those unfortunate districts. Within Punjab, most prosperous province, the situation is that $70 per capita in Lahore on healthcare, less than $4 or $5.
My God.
In all these southern Punjab districts. So this is the level of inequity. Inequity is not just a construct in our minds. It's not a philosophical question. It manifests itself through figures, through our allocations, and their consequences. And the consequences are that if we have, let's take example of stunting, or let's take example of women health. Women in reproductive age, according to National Nutrition Survey of 2018, their percentage was 49. 49% was the average.
I see, sir.
But this average, when you go to rural Sindh, when you go to Balochistan, when you go to erstwhile FATA districts, this goes to 60, 70, 75%.
Wow.
Take example of routine immunization. Where are the children who are maximum with 0 dose of routine immunization? Meaning they are not being immunized at all. They are all in those districts. And they are concentrated in those districts. So equity is not just something
ephemeral,
a philosophical discussion which you can have long discourses, and it is hitting and killing people today as we speak.
So I can only assume that this is a snowballing effect, that if you have a child who at a young age gets a disease that affects him for the rest of his life, that has now affected him, his livelihood, family, everything.
Absolutely. And apart from this ignorance or neglect that we have, what we need to understand also that it's not just a slogan or a political statement when we say that the lack of healthcare or public health crisis that I was referring to is a national security issue.
I see.
And why I say this? When you have your 40% children stunted, and stunting need to be understood. Stunting meaning physical stunting and mental stunting.
I see, sir.
And if it is not taken care of during the first 1,000 days of the life of a child, it becomes irreversible.
So under the age of 3 is what matters then?
Yes.
Wow.
So these children, if they remain unaddressed for their malnutrition and other factors, and it's not just a question of malnutrition, it's number of other factors, these children who will be, when they will be adolescent and when they will be young adults and when they will be productive, enter into productive age, they should be the productive factor of economy.
Absolutely.
When 40% of your population is suffering with stunting and move on beyond these 3 years, instead of becoming productive factors of economy, they will become a liability for economy.
Absolutely.
They will not get good jobs, they will not be able to get good education, they will not be as productive as they should be. So it has direct connection with your economy, with your economic growth, with your productivity in the country,
and overall national security.
And national security. And then, if you actually invest in health, there are also econometric studies which informs you that $1 spent on child's health at the right age for right interventions gives you, the return of investment is very, very high.
Wow.
In the region of 40%, 45%. You spend $1, you get $45 back. That's the kind of return on investment by spending on health of the people.
Wow.
And yet we do not understand this. And when you call it a national security issue, people, make faces.
Mm-hmm.
Because you work in health, you have to promote this.
This is
This is your bread and butter. That's why you call it. No, this is. We are sitting on a huge problem.
So I think there's enough objective evidence out there to.
This is why I say this, that we have to really change our approach and our mindset to the health of the people of Pakistan.
Yes, absolutely.
And one more thing, Vaisa. The point is that if you do not do this, then you end up spending huge and limited resources you have on dealing with
the aftermath, the repercussions,
and these consequences. It begins by such fundamental intervention, which is preventing diseases.
Absolutely.
By addressing the risk factors. right?
And that will always be cheaper. Always will be cheaper than.
Always be cheaper. You spend 300 rupees in screening a person to see that if he or she is hepatitis C positive or not.
Mm-hmm.
You end up 1 crore rupee in transplantation of liver.
Wow.
This is the natural history of a liver disease. It end up in cirrhosis.
Absolutely.
There is no treatment of cirrhosis but liver transplant.
I see.
Today you spend 10 million rupees. You did not, because you did not spend those 300 rupees to screen them at the right time.
Absolutely.
So these are the kind of differentials which are mind-boggling, and you don't have to be Aristotle to understand this.
Mm-hmm. Absolutely.
And yet our priorities are somewhere else.
So just to again emphasize this point, I want to go down to a particular topic, and you recently again wrote on this, which is HIV/AIDS in Pakistan, and the epidemic, which you've labeled as just the tip of the iceberg. Could you elaborate what you mean by, and I think you were referring to the Tonsa, the epidemic there.
Yeah, it's very, very straightforward. HIV is generally a concentrated epidemic in high-risk groups.
All right.
Sex workers, injectable drug users. In Pakistan, one of the unique features of this unfolding epidemic in Pakistan is that our innocent, very young children are getting infected. Their mothers are negative. Their mothers are not HIV.
So they're not transmitting it to their children.
So there is no vertical transmission. So then the question is from where these children are getting infected. So when the government itself investigated, you mentioned Tausa, let's take example of Tausa. When they investigated, they themselves came up in their investigation report that 48% of children got infected because of reuse of disposable syringe.
I see.
Injectable. And 48% of them get infected because they had blood transfusion and the blood was unscreened.
My God.
Now, this is not a crisis. This is a crime.
This is pure neglect.
This is crime. I mean,
Absolutely.
there is no
This
other
is
way
criminal.
to
You're right.
explain this. And this is actually happening. Coming back to your point about tip of iceberg. So the question is that when, as you know, that this was all revealed by BBC documentary. BBC documentary was made in Tausa, and they revealed these unsafe medical practices which are going on in our health facilities. My question is it happening only in Tausa?
That's the only place we got a window into, a glimpse into.
Exactly. So that just provided us this window through which we saw this problem. Same medical practices are prevalent across the country.
My God.
So hence it is a tip of the iceberg.
I see. Absolutely.
We never know and will never know what is the actual number of children who are, or people at large, who are getting infected. You can carry HIV virus for 8, 9, 10 years and you will not have symptom and you would not know that you have HIV, but ultimately you will fall sick. But during this time, you can spread that virus. Yeah. Although it's blood-borne, it's not that easy, but potentially you can. Course. I was speaking recently with a doctor at PIMS, and she was telling me that it used to be very few donors who come for giving their blood for blood transfusion.
Of course, sir.
So there is a standard operating procedure that when a donor comes, you first take a small sample and test it.
I see.
And test it against these diseases also. She said it was very rare that we used to see HIV. Yeah. Now every month, 10, 15, 20 donors we are seeing them
with HIV.
HIV.
My God.
This is in Islamabad.
This is unbelievable.
Unbelievable. And actually, that's why I'm saying, and I'm screaming actually almost in all my podcasts, all my
Articles,
articles, media appearances, that we are sitting on the edge of a generalized HIV epidemic in Pakistan. And those who don't know, and those who are listening to this podcast want to know, go back and read the history of HIV and the devastation that it created in the continent of Africa.
Absolutely. Absolutely.
Just try to Google this and you will know that how it devastated the already poor economies, how it devastated societies, how it devastated families and communities.
Absolutely.
Still struggling, but they have come out because now better treatments are available and there is much better knowledge about it. In Pakistan, according to WHO and UNAIDS, among Asian countries, Asia Pacific, South Asia, Eastern Mediterranean region in which Pakistan falls, it is the fastest unfolding epidemic in Pakistan.
My God. So Pakistan has the fastest
among all these countries.
My God. And we're blind to it because we don't have the data, we don't have the screening.
And our government response to this epidemic is pathetic. I have no other word, but it is pathetic. 90% of money being spent on HIV epidemic in Pakistan comes from external sources. 90% for the last 5 years.
So it's not on the government radar, essentially.
It's not on the government. Even if it is on the government radar,
they're not putting their money where the mouth is.
I put it this differently. If government is committed to take care of these people, there is no commitment without financial commitment.
Of course, sir. Welcome.
So when you are spending 10% of the total expenditure on these people, where is your commitment?
That's true.
So it's a very, very serious problem. And one day, God forbid, we will all be endangered, we will be suffering, and we will be at least seeing a lot of suffering around us.
It's very true.
So it has to be dealt. It has to be dealt very, very seriously.
Absolutely. Sir, I want to come to my last question. You had said that this is criminal.
Achha, if you allow me,
please.
You allow me one more thing which I wanted
sir.
to say, because I want to connect this also with your earlier question of equity.
Absolutely, sir.
So, who are these children who are getting HIV infected? These are all poor families, poor children in rural settings, away from provincial capitals, poor people, voiceless people, disorganized, don't have voice, and hence we very easily ignore them. Again, a question of equity. Had it been children in defense of Lahore and defense of Karachi and
sectors in
area
Islamabad,
of Islamabad and E7 of Islamabad, it would have been a very different.
Would have been a national scandal. There would have been heads would have rolled.
Different. People have been, reprimanded. Resources would have been made available. All that government should be doing, would be doing.
Absolutely.
And hence again, it is an equity issue, it's a governance issue, it is a systemic issue. So unless we deal with those big elephants in the room, we cannot provide just technical solutions to the problem.
Very true.
Sorry, I took it.
No, sir. So the question that I wanted to ask was, you had labeled this as criminal. I remember in law school, we were studying a UK case in which a person intentionally gave several women HIV by sleeping with them, knowing that he's positive. They sued him in court once they got this, and they were successful in suing him for grievous bodily harm, which is the highest form of harm that you can cause someone short of death, killing them. Do you feel that our laws are inadequate in dealing with this because it is such a serious thing? Should there be some form of liability when there is, state functionaries or hospitals that are causing this type of harm, permanent harm to people?
Thank you for asking me this. Thank you. There are two health-related issues in Pakistan which need legal action. And people like yourself and your colleagues should support this and advise, actually, that how public health should benefit from this. One is HIV.
I see.
We have on record more than 1,000 children which were infected in Ratodero in 2019.
Yes, absolutely.
Ratodero and now Tonsa. Tonsa is 9th recorded outbreak of HIV since 2008-2009. And in all these outbreaks, there are a number of children who have been infected for the same reasons that we talked about earlier. Hospitals and the healthcare system itself has become a vector for spread of this disease. Many of these children are on record, and we know them, their families, their names, their treatment history, etc., etc., etc. So there is no dearth of evidence.
Absolutely.
Right? That's the point I'm making. I think that there must be a class action.
I see.
There must be a public interest litigation where government must be made responsible for this, which should not be very difficult, and then government should take care of these children. It's a lifelong disease.
Absolutely.
It's a lethal disease, and you have ruined lives of these children and these families.
Absolutely.
So that's one issue. And the second issue is tobacco and the consequences of tobacco, and the liability that the tobacco companies must be paying to the victims of the users of their products who have been affected. 70% of lung cancer is because of tobacco.
Wow.
70%. Again, there is no dearth of evidence.
Of course.
And as a lawyer, you must be knowing that how in high-income countries, when there was public interest litigations on tobacco, Minnesota case is a case in
standard.
point.
Absolutely.
Yeah, more than $500 billion settlement took place there.
Yes, there were a number of absolutely.
Over 10, 15 years, they had to pay to those families, and it was out of court settlement.
Wow.
The case was so strong and so incriminating and so crystal clear that ultimately tobacco companies decided to settle this with people outside the court. And outside court settlement was more than $500 billion.
It's unbelievable. Wow. $500 billion.
I personally believe that now a time has come that lawyers in Pakistan and legal scholars in Pakistan help to get relief to these victims of tobacco.
Absolutely. So, but again, many people in Pakistan would say the tobacco industry brings jobs, it brings money, taxation, highest taxpayer, all of those things. But I think you have to weigh that against the cost that they are imposing on society.
At what cost?
Absolutely.
If smokers become addicted to tobacco, our governments have become addicted to tobacco revenues.
That's true. That is very true. Very well put, sir. Very well put. Sir, thank you so much. I'm very grateful for you taking out the time. I know you have a very busy schedule. Ladies and gentlemen, this is all we have for today. If you've been watching this on television, this is a shortened version of our podcast. If you want the entire podcast, please visit DawnNews English's YouTube channel. Thank you very much.